And as we move on to the selective beta-1 receptors, recall where the beta-1 receptors are. They're mainly on the heart, the GIT, and the kidneys. In the heart, the selective beta-1 agonist will have a positive chronotropic effect. In other words, it increases the heart rate, and a positive inotropic effect. In other words, it increases the contractile force of the heart. Chrono means time, so it's beats per minute, and inos means fiber, so how much it stretches. Now, the important thing about the chronotropic and inotropic effect is that it needs to be preceded by positive or negative. So you'd have to say positive chronotropic effect. Just saying chronotropic effect simply means that it has an effect on the heart rate. And just saying a inotropic effect, it just means that it has an effect on the contractility of the heart. You'd have to use the positive or negative preceding that word in order for it to make sense. And because of the actions of these medications, they're most useful in circulatory shock, hypotension, and cardiac arrest. So they're, once again, a medication that's used in acute heart failure, and they're used in a hospital setting, and they're normally injected. The one selective beta-1 agonist that I'd like you to remember is dobutamine. So you should know the drug just by the fact that it is a selective beta-1 agonist, and you probably don't need to know much more about that. And finally, the beta-2 receptor, that's located on the lung, the mast cell, and also the skeletal muscle. So you can probably predict what it's going to be useful for. Being on the airways, that's going to dilate the airways, and the action on the mast cell is to stabilize the mast cell. So what do you predict that the beta-2 receptor agonists are going to be useful for? And yes, the primary use of selective beta-2 agonists is in the treatment of asthma. It's going to result in a bronchodilation and a stabilization of mast cells that's very helpful in asthma. The medication that I'd like you to remember with respect to the beta-2 agonists is salbutamol, and that's a medication that's also known as Ventolin and by other brand names as well. Salbutamol is available in an intravenous formulation, by pill, and in a liquid. But by far the primary way in which it's administered is by a metered inhaler, and sometimes we refer to it as a puffer drug. The primary side effect of salbutamol is a muscle tremor. Remember that the beta-2 receptor is found on skeletal muscle, and the person may also get a racing heart or other side effects because there's some potential crossover effects onto other adrenergic receptors.